Good afternoon, everyone, and welcome to today's webinar titled Patient Financing, a Win-Win for Your Practice and Patients. Really excited, big crowd today, so let's put on a show and razzle and dazzle and have some fun. But I am thrilled to have you all here to go over this topic. So just by way of introduction, I am the voice behind the curtain, Peter Hawes. I will be your guide today. So here at Next Trust, I work mainly with our resellers, but I personally joined the ranks of healthcare many years ago as an executive director in the long-term care and rehab space. Yes, I ran a nursing home. Me and my family have also been healthcare patients many times, especially in the ER. I have 4 kids, and where we've taken advantage of patient financing, that's one of the reasons I'm so pumped about today's topic. Now, before we begin, we understand that questions will arise during the webinar for many of you. However, to ensure all questions are answered promptly, we ask that you please either write them down or remember your question for later. And then during the last few minutes or so of the webinar, we've set aside some time specifically for Q&A. So let's get started. Today, we'll discuss the advantages of flexible payment options and how they can lead to an enhanced customer payer experience for your patients. We're going to explore the financial benefits of offering patient financing for your practice, how to increase patient satisfaction and retention through patient financing, and practical strategies to successfully implement and promote financing options. Then later, we're going to talk about FlexPay, which is an easy to offer, easy to apply solution for patient financing. And not to jump ahead, but providers get paid in full upfront. Just remember that. So patient financing provides access to the care your patients need and want with flexible repayment options that allow them to pay their balance over time. So let's look at some of the benefits of offering patient financing. Now, how does patient financing benefit and make a difference for your patients in practice? Currently, patient obligation is over 50% of the healthcare dollar. With the shift in financial obligation weighted heavily on the patient, it's increasingly essential for practices to adopt efficient billing and payment processes. Research shows that as patient financial responsibility rises, and as far as we know, it will continue to rise, the likelihood of collecting patient payments in a timely manner significantly decreases. That's not okay. Let me say that one more time. As the patient financial responsibility rises, the likelihood of collecting patient payments in a timely manner significantly decreases. And it's an interesting thought here because if you've been on previous webinars, we've shown a statistic that 90% of patients want to pay their bill in full. And so why are the payments dropping so drastically? Well, consider this. If you look at the screen, the average bill across healthcare is $600. Yet 40% of Americans can't afford a $400 unexpected bill. Go up to $600 and that jumps up to 67%. That's a big discrepancy. And so what happens? What does this lead to? Well, either patients delay payment or abandon payment. And providers are failing to collect 30 to 50% of patient balances right now. And that's a crazy statistic. We're here to provide care, but we also have a business to run. And to think that providers aren't collecting 30 to 50% of the patient balance, and now we know that that's half of what's owed, it's getting mind-boggling. We need to be more effective. So even though with insurance, you still have individuals that struggle to pay the out-of-pocket for needed care. In the past, the patient would have had to make difficult choices. So either back out of a procedure or rack up credit card debt or take out a high interest loan with strict payment terms. But there is a way to change this dynamic, to lift the financial burden from patients while boosting your bottom line at the practice. By offering patient financing options, you can make essential and elective treatments accessible to more patients. Patients can get care regardless of their insurance status and break up expenses into manageable monthly payments instead of large upfront costs. For example, A patient who needs a $5,000 procedure but can't afford to pay that amount up front may be able to budget $200 in monthly payments over 2 years. This allows the patient to move forward with the procedure they need or want. A personal example, my wife and daughter ended up in the ER last January, 2 different instances, and I had a $4,000 bill. Could I have paid the bill? I could have, but I was offered interest-free payments for 12 months. So I took it, and I would take it every time because it was less of a burden on me. So this isn't just people that can't afford the $400 expense. This is making sure that everybody is comfortable with their financial situation and put in a place where they don't have to make crazy budget decisions. So this approach not only helps your patients, but it also enhances your practice's revenue, creating a win-win situation. Implementing patient payment plans can transform financial stress into financial relief, ensuring timely patient care and steady income for your practice. Also, an increased level of accessibility can have several benefits for your patients. One, more patients can get the care they need when cost is less of a barrier. This includes important services like preventative care, chronic disease management, and necessary treatments. Two, earlier intervention is possible when patients don't have to wait to save up for their care. This leads to better health outcomes. Three, more patients opt to complete elective procedures when financing is an available option. Four, more options for where to seek care, as patients aren't limited to low-cost community clinics. And five, reduce stress from medical bills and improve financial well-being. Those are all great benefits for the patient. So now let's discuss how practices benefit from patient financing. Many practices still face significant hurdles, with 83% of physicians reporting slow patient payments as their greatest challenge. I'm sure that everybody on this call is probably nodding their head because we're going through that. Dealing with patient collections, credit checks, and piles of administrative paperwork can be a massive headache. It takes up your staff's valuable time, which could be better spent on more meaningful work. But with modern financing solutions like payment plans, online payment portals, billing applications with integrated collections, those mind-numbing manual tasks get automated. Streamlined processes can save your staff a significant amount of time and effort. Patients are becoming very savvy shoppers when choosing medical providers. Just people in whole are becoming very savvy shoppers. But when it comes to selecting a new doctor, they'll often do extensive research and read online reviews. In fact, as you see on the screen, 70% of patients read online reviews before scheduling an appointment with a new provider. So what they're hearing matters. Offering patient financing can give your practice an edge that attracts more patients. Practices that offer financing stand out by addressing patients' financial concerns up front, understanding their financial limitations, and willing to work with their financial situation creates trust and shows the practice cares about the full patient experience. Patients highly value this convenience and peace of mind. When a practice offers financing, it shows patients that their needs are not being placed on the back burner. Patients feel empowered to move forward with the needed care. And so then you'll get better referrals. You'll get a higher score if they're looking for you online. So the result, you're going to hear this time and time again as we go through this, results in referrals and repeat visits. When cost is no longer standing in a patient's way, this opens up opportunities for new revenue streams for the practice. Patient financing programs can help do the following. They can attract more patients, leading to what? Referrals and repeat visits. There can be an increase in case acceptance rates. Patients are more likely to move forward with treatments and procedures that have been recommended by their medical provider when they're presented with affordable payment plans. Remember, 90% of our patients want to pay in full as long as they have a way to do so. Can grow revenue. By improving case acceptance rates, practices can generate more revenue from procedures that may have been delayed or declined due to upfront costs. And then improved collections. Instead of losing revenue from unpaid medical bills, financing allows practices to work with patients and collect payments over time through payment plans. The result, referrals and repeat visits. So we've seen the benefits for the patient, we've seen the benefits for the practice. Now let's explore effective strategies for implementing patient financing into your practice. So as we've been discussing, offering patient financing can make care more accessible and affordable, while also benefiting your practice through better collections, increased number of patients, and marketing differentiation. They need it, you need it. Following these guidelines will help you successfully implement financing into your medical practice. So you need to provide clear communication to patients about financing terms, costs, and consequences of non-payment. Having clear prices and financing options available up front allows patients to budget and plan for a procedure. This also avoids stressful billing surprises down the road. We need to maintain transparent pricing and billing practices. We need to make sure that financing eligibility and approval processes are fair and applied consistently. You can't take the bias out of people, but you can take the bias out of a process, hence talking about automating processes like this. And then you need to protect patient data according to security best practices. Today, patients have more choices than ever, and this positions financing as a strategic advantage. They're more engaged in their care and more likely to follow treatment plans. By expanding access and reducing financial burdens, financing options strengthen the patient-provider relationship from the beginning. And yes, you've guessed it, this results in referrals and repeat visits. Integrating patient financing option requires some key steps to ensure successful adoption and maximize the revenue impact. So you need to select a financing partner carefully by evaluating factors like interest rates, payment plan flexibility, application experience, reputation, and integration capabilities with your existing technology. Training employees, training staff members, vital in all of this. We need to provide training to all staff members who will discuss financing options with patients. We need to have training sessions, provide employee resources. And what we do in sales, especially with new employees, we provide scripting. Why do we provide scripting? Well, scripting ensures that they're following the plan, that they're saying the right things, but it also helps them feel more confident and it helps them do a better job. So as a suggestion, in the same scenario, write out suggested patient conversations and develop conversation guides for staff discussing financing availability. Make sure you also have consistent and compliant messaging. Patients need to be aware of the new financing options. How do we do that? Well, we need to update all the patient forms, documents, pre-visit information to reflect the new financing options. We need to make patients aware up front. We need to market the new financing program across our website, social media channels, emails, as well as any other patient communication. Use language highlighting the increased affordability. And we want to monitor key metrics like financing application rates, approval rates, revenue impact after launch. We want to improve processes as needed based off of the performance data. So this is called benchmarking. We take the numbers up front, and then we monitor them and we compare them to the benchmark. And benchmarking these metrics establishes a solid baseline, allowing progress to be measured moving forward. Are we getting the ROI? Is it being effective? What can we do? Now, offering patient financing is a win-win for healthcare providers and patients. It expands access to care by giving patients flexible options to pay out-of-pocket costs over time. For providers, it drives revenue through increased case acceptance, improves patient loyalty and competitiveness, and streamlines payments with steady upfront cash flow. Dun, dun, dun. In a time where patient responsibility amounts continue to grow, offering flexible financing solutions is becoming increasingly important for medical practices. The benefits of providing patient financing options are plentiful and cannot be ignored. And solutions like BillFlash FlexPay streamline the financing process for practices and patients. The average customer credit score across healthcare is 599, which starkly contrasts with the higher credit thresholds required by traditional financing methods for approval. But what do typical approval rates look like with traditional patient financing? Great question. Let's take a look. Traditional patient financing options are increasingly failing both the patients and healthcare providers. Practices are often burdened with the uncomfortable task of selling financing options to their patients, diverting focus from their primary mission of providing care. How many of us or our front office staff have felt that way? I'm here to provide care. I'm not a salesperson. Patients face the frustration of lengthy application processes, frequently involving copious amounts of paperwork, and they have to endure anxiety as they wait, fingers crossed, to discover if they're going to qualify for the financing that they need. Shockingly, and you can see it right there on the third bullet point, about 60% of patients are declined through these conventional financing methods. 60% declined, only 4 in 10 actually even get the financing, leaving most without the necessary funds to cover their medical expenses. This high decline rate not only hinders patient care, but also impacts the practice's revenue and patient satisfaction. Traditional patient financing options predominantly cater to consumers with above average credit, effectively sidelining a significant portion of the patient population. As a result, a lot of patients with lower credit scores are left without viable financing solutions, creating a substantial gap in access to necessary medical care. This discrepancy not only perpetuates financial strain on these underserved consumers, but also undermines the overall effectiveness of healthcare practices. And what are we doing? We're striving to provide inclusive care for all patients, but that's not what this is affording us. So what are we doing about it here at BillFlash? Great question. BillFlash's FlexPay aims to bridge this gap, offering more accessible and equitable financing options to a broader range of patients. In fact, with BillFlash's FlexPay, 90% of patients are approved. 90%. So in traditional methods, around 4. Through BillFlash, 9 in 10. 4 in 10, 9 in 10. Huge difference. And the patients are going to be happy. Why? Well, 30-second application. No more cumbersome paper applications. Our online application process is quick and easy. There are no hard credit checks to apply. Patients can view their options without impacting their credit score. And oh, there it is again, that 90% approval rate. Balances as low as $60 can be financed. There's no late fees. Every approved patient will have a 0% interest financing option. If you've been in the patient financing world, this should be blowing your mind. And I think the next slide will do just the same. That's keeping our patients happy. How do we keep providers happy? Offering FlexPay can significantly benefit healthcare providers also in multiple ways. First one we see, providers get paid in full right away, with payments initiated within the next business day, ensuring a steady cash flow. There's no operational lift, as BillFlash manages every aspect of collecting patient payments, and providers face no recourse for patient non-payment. Let's touch on that again. The provider faces no recourse for patient non-payment. Why? Well, because in the first tile, they were already paid right away. BillFlash has assumed responsibility. If you drop down to the bottom left tile there, FlexPay also helps attract more patients, since cost of care and travel time together comprise more than 70% of a consumer's choice when selecting medical providers. Offering patient financing can differentiate providers and draw in new clients. What makes you different? What makes you stand apart? This is one of those things. Additionally, FlexPay aids in retaining existing customers. Why? Well, by enabling them to say yes to recommended treatment plans and pursue care and elective procedures they might otherwise defer. By minimizing awkward conversations at the time of payment, FlexPay facilitates more positive interactions and speeds up the time to collect payments, enhancing overall patient satisfaction and operational efficiency. So, how does it work? We understand why it needs to work. How does it work? You see a 3-step process here. Step 1, whether your patients received a mailed bill or an e-bill notice via email or text, we'll notify them that they now have the option to pay their balance in monthly installments with BillFlash FlexPay. Step 2, patients can easily apply with just a few clicks, receive personalized options, and choose the payment plan that works best for them. Done. Step 3, your practice gets paid in full right away while BillFlash manages the payment plan and collecting payment from the patient. Done. It sounds easy because it is easy. Just to give you a scenario, you might have a patient standing in the office that asks about patient financing. You can write out of BillFlash, send them a text message. They can click, apply within 30 seconds. It's done. It's that simple. And that's just one of the scenarios. With quick approvals, low interest rate options, and provider payment right away, FlexPay empowers practices to boost their bottom line by providing more payment options for their patients. And that, as they say, is a wrap. Thank you so much for joining us today. Our goal at NextTrust is to streamline your billing processes, reduce administrative burdens, and enhance your financial efficiency with our innovative BillFlash solutions. BillFlash FlexPay is created with that singular goal in mind, to get you paid. Ready to elevate your practice's revenue by offering FlexPay patient financing? Awesome. Schedule a demo with BillFlash now and discover how FlexPay can help you grow your practice. Now that's whether you are a current BillFlash customer or not. You can go to billflash.com/FlexPay and schedule that demo. I'd be more than happy to go over the finite details of how it works. Thank you again for joining today. And remember, it's a great day to have a great day. Until next time, this is Peter Haas signing off.